The evolution of facelift, or treating the aging face, in my practice over the past 15 years has been one of the most satisfying things I've experienced in cosmetic surgery. I was educated and trained in fellowship on aging face procedures, but what I brought initially to the table was I was a good technician. I could execute the operations very well. However, what I learned over time is much better patient selection, particularly for the incredibly diverse armamentarium of procedures that exist. The reason why there are so many procedures is there's no right one for everyone. To say this more simply, circa 2007, the operative plan for someone who was concerned about some sagging skin was to lift everything, a brow lift, a mid-face lift, a lower face lift, a neck lift, eyelids, smooth something out with resurfacing, and then repeat for every patient. Contemporary facelift in my practice is very much attuned to the specific concerns that identify age in the mirror for that patient. So that may mean in a heavier set neck, a patient who has never liked their neck appearance from age 18 to age 71 may need a deep plane facelift, because that is the right procedure for their neck. Whereas someone who has always enjoyed a particularly sculpted neck but has some muscle banding, some lines, and a little bit of skin laxity, then the absolute wrong procedure to do is a deep plane neck lift. A mini lower facelift is the more appropriate procedure.